Hello, I'm Dr. Ghaffari. I am one of the early pioneers developing IPL technology, and I work extensively with people such as Dr. Patrick Bitter Sr. in developing photofacials, as well as a number of applications that was for skin treatments, including pigmented lesions, vascular lesions, hair removal, and skin rejuvenations. I'm the president of Venus Medical Solutions, and as I look back about 20 years ago, late in 1990s, I did the video training discussing the scientific and clinical applications of IPL technology that I think you will find interesting. I encourage you to see them, and there are different segments that talk about different aspects of the technology, and I hope you would enjoy them.
Now let's turn attention to typical targets that we are trying to treat during normal settings. For hair, coarse hair, typically if you dial your total time to be 30 milliseconds, pretty much most of your coarse hair will be treated properly. But as you move away from 30 milliseconds towards 100 milliseconds, you're selectively treating larger size hair more effectively, and the finer hair will come back. For fine hair, 20 milliseconds is thermal relaxation time. Now what happens if we dial in fine hair 20 milliseconds and treat all hair? Effectively, fine hair setting will treat thicker and coarser hair, fine as well as finer hair. However, because these machines have limitation, until we recently introduced the sapphire contact cooling, they have broken it down into fine and coarse hair. And in certain cases, you may want to selectively go after the coarse hair and leave some of the fine hair in place. Now, let's turn our attention to blood vessels. There are different types of vessels and different conditions that you typically come across in a clinical setting. There is a condition for very, very small size vessels. Typically, rosacea cases fit into this category. The size of the vessels are 10 to 40 micron, so we consider those to be very, very small. And for those types of vessels, the typical thermal relaxation time is between 3 to 10 milliseconds. As we go to larger size vessels, telangiectasias, the thermal relaxation time moves within 10 to 20. Medium-sized vessels, 20 to 50. Large-sized vessels, however, less than 1 millimeter vessels, in a 50 to 200 micron, and very large size, 1 millimeter up to 3 millimeter, fits into 200 up to 500 millisecond total time. And the above 3 millimeter size vessels typically are not good targets to be treated with light therapy, because the light does not have enough energy at depth in the 4 or 5 millimeter to cause enough damage to the vessel walls. Consequently, when we look at the types of targets we have, for example, in the case of rosacea, then coming back and knowing what range of delivery of total time of these pulses should fit in, that gives us an idea how to push the limits on the boundaries of treatments. Typically, we have developed a manual that can address a number of different conditions, and there is a manual set for the photofacial and manual set for hair removal, which I'll go over the details. However, what we wanted to establish here is what will be a typical setting, and I'll go over the details of what they mean as we move forward here. And the real results that we are getting and how well we can push the boundaries and limits relates to the understanding we develop as to how we're delivering these pulses and what time frame we put this in and how it relates to our target.